So 2 letters are there for Vineetha. Next one, get ready. Yeah. So that's fine. Here it is. So Mrs. Elizabeth Cole, Community Health Nurse, Community Health Center. 9 November 2019. N should be a little taller. Dear Mrs. Cole, regarding Boby Cole, date of birth 30 October 2019. Boby Cole, comma, a 10-day old baby. A 10-day old baby. A 10-day old baby. This is the way how you have to write. 10-day old baby. A 10-day old baby who referred to your facility. Okay. Who Bobby Paul, a 10-day old baby. Why who then? No need of who. Is being referred to your facility. No, you can write like this. You can keep this one. Something is missing here. Something is missing here. Okay. Who yeah, Bobby Paul. Bobby Paul. Gastric reflux. Gastric reflux. Thirty, 10, 111, 211, 311. Who was diagnosed with gastric reflux? Maybe. I don't know. Some problem is there with this case. It's not very clear. Is free or diagnosed? Gastric reflux increase. Just now only, na? Who was diagnosed with gastric reflux? Who was diagnosed with gastric reflux, comma, is being referred. Miss Bobby Paul, a 10-year-old baby who has been, you can say, recently, na? Okay, who has been diagnosed with gastric reflux, is being referred to your facility for monitoring his development. His mother requires post-operative healthcare education along with breastfeeding techniques. His mother requires post-operative healthcare education. So requires education regarding, you can say, education regarding this education regarding post-operative healthcare along with breastfeeding techniques. You can say like that. Education regarding. Okay. Yeah. Today, Boby presented to our emergency department with his mother with the complaints. Emergency department with his mother with the complaints. Today, Boby was presented. He did not present. He was presented with the complaints of gastric reflux and vomiting. On assessment, his health condition has been stable. On assessment, his health condition was found to be stable. On assessment, his condition has been stable. Okay. Although his mother's wound, apostrophe S. Although his mother's wound is healing well, the nipples, the nipples lacerated, painful have been noticed. The nipples were lacerated and painful, or the nipples were lacerated and painful, you can say, were painful. Have been, or pain, laceration and pain in the nipples has been noticed. Have been noticed. You can say like that. Laceration and pain in the nipples have been noticed. Like that also you can say that the nipples were lacerated and painful. That is enough. Or if you want to write have been noticed, then you have to say laceration and pain in the nipples have been noticed. Like that you can write. Both are right. The nipples were lacerated and painful. That's fine. Therefore, she was commenced on fluconazole cream, tablet naproxen, and tablet Panadol. Then initially the why initially the baby was born? Why initially? Why the word initially? I don't understand here. Okay. Initially the baby was born. Initially only will born, not later. No? Okay. The baby. I have to say the baby. The baby was born through an emergency lower segment cesarean section with a birth weight of 3.5 kg and Apgar score 4. On examination, gastric reflux was noticed in the event of difficulty in breastfeeding, for which breastfeeding instructions have been provided. Instructions have been provided. It will be plural, not just one instruction, it will be many instructions, more than one at least. In addition, his mother had a depression owing to feeding problems, or a feeding problem or feeding problems, right? Singular or plural. Owing to a feeding problem or feeding problems, right? Plural better. Supplementary bottle feeding problems. In addition, his mother had depression owing to feeding problems. Supplementary bottle feed has been advised. Consequently, write full stop here and say capital letter. Consequently, therefore, or consequently, supplementary bottle feed has been advised. Okay. During hospitalization, she was managed with amoxicillin 500 mg for 7 days, as well as, oh, why are you writing as well as like this? Okay, as well as you have to be very careful. For 7 days, full stop. Refraining from, so here, refraining from, next sentence, refraining from strenuous activities for 6 weeks. For 6 weeks, refraining from strenuous activities for 6 weeks has been instructed. Okay. Or recommended, suggested, anything. This is also correct. In the aforementioned circumstances, regular assessment based on the aforementioned circumstances, regular assessment for the baby's growth. Growth means development only. What do you mean by baby's growth development? Anyone is enough, no? Regular assessment for the baby's development. Remove growth, or remove development and put growth. And for the baby's growth and the mother's health. And the mother, only one mother is there and only one baby is there. So the mother, the baby. Mother's health and breastfeeding support respectively would be profoundly beneficial for their health condition. Their health conditions, two people are there. In case any additional information is extremely relevant, is deemed extremely relevant, please do not hesitate to contact me. Very good. Yours sincerely, charge nurse. Yeah. Yes, that's it. Yeah. Akhil, ask Dr. Dilip Singh to be ready. Sharon Samuel, Vijay Mani. One after another schedule. Okay. Next, who is? Vijay. Okay. Ask her to be ready. Next letter. Finished. This is finished. So, you have to be little careful. This is a little confusing letter, but still it's okay. There's a lot to learn. Yeah. She was managed. The condition was managed is better. Okay. So here, Vineetha, is there any doubt?
No, sir. Clear, sir.
This is done. Next, I will correct Vijay's letter and I'll get back to you. Okay.
Okay, sir.
Okay,
Thank you,
fine.
sir.